I mean, this is why I don't love the term disruption for healthcare, right? I mean,
Yeah.
you don't disrupt, I mean, medical care, right? Like you can transform, you can evolve, totally.
Yeah.
And in my mind, so I totally agree with you that one of the biggest problem we have in healthcare is the fragmentation of incentives. Yeah. Say, have the fragmentation of point solutions for AI, but honestly, all of healthcare is like a bunch of point solutions, aggregated together. The payer doesn't have an incentive, the same as the health system. So in my mind, one of the counterintuitive things we've learned is that you have to elevate the conversation a bit at least. So a big trend for us was going from the physician to the health system as an example. Why? Because now you can at least connect the value dots on a care pathway. I'll give you one of the things that really hit me. There is there was something called NTAP, which is stroke AI reimbursement, temporary
Mm.
reimbursement. And it was about $1,000. So $1,000 to run an AI that calculates, and I'm simplifying, so but bear with me.
Sure.
So
Of course.
the lessons there, but so $1,000 per patient to analyze and find suspected stroke and alert somebody in the system. Do you know how much a radiologist gets to read and diagnose and finalize the report on the same exam? Maybe $150. You would ask yourself, why the hell is an AI
Where's
doesn't
the 850 going?
Well, yes. Well, why isn't an AI that like barely does one thing out of the full report gets like 7 times? Well, now let me flip the question as it relates to incentives. What is a stroke DRG? So how much a hospital gets for a stroke patient? Let's say around $30,000, $40,000, right? Depends. Would you pay 3% extra to get an expedited care pathway? Oh my God, 3%? That's a bargain, right? That I think was the key for us understanding the fragmentation of value. If you're just looking at the physician fee, I mean, fine. But that's not what you're optimizing. You're optimizing the
That's true.
whole thing. And that is why I really believe AI decision has to be taken at an enterprise level. If you just look at it from a service line perspective, you might lose the big picture, right?
No, that's a great way to put it.